All right. Well, welcome everybody. We are so happy to have you here on a Friday for this webinar on transitioning from the federal workforce, exploring new industries and career pathways in public health. We have the Q&A box open and available for you anytime during this webinar, so feel free to submit questions while Dr. Bocchino is presenting. We have some folks in the background that will be answering some questions during the webinar, and then we'll have lots of time for discussion towards the end. So my name is Brenda Nickel, and I'm the Director of Career and Professional Development at the University of Nebraska Medical Center's College of Public Health. But today I'm actually joining you in my role as one of the leadership team folks of ASPPH's Career Services Assembly. And I wanted to point that out because if you are a current student or an alumni of any school or program of public health, you have this whole cohort of people working behind the scenes to help you be successful that you probably don't even know about. And so one of those groups is the Career Services Assembly. If you are one of those people at a school or program of public health joining us and you do career services and you are not already connected to the Career Services Assembly, then make sure you join our online community because we share and exchange ideas all the time. And this webinar is one of the things that has come out of that body. So we actually have created a 3-part webinar series designed to help you navigate the current job market. The first webinar was held in March and was focused on how to really leverage your public health training. And the second one was all around self-care and managing the stress of the job search. And now this is our third and final part of the series, and will be focused on folks who may be transitioning out of federal employment, but really given the current context, we've kind of expanded it and it's really going to have content relevant to anyone who's on the job market right now, of really how to understand how the training that you have gotten or are getting in a program of public health can translate to all different sectors and all different types of roles. Because you're so focused on those public health core competencies, sometimes it can be tough to understand the language of how they show up on the job market. So that's what today is all about, and we're really excited to help you with this. Next slide. The very first question, yes, this is being recorded as we speak, and it will be on the ASPPH website soon. And the really great thing is that if you go to that website or if you go to the ASPPH YouTube channel, you will also see the recordings of those previous 2 webinars. So use them, share them with your colleagues, etc. They're packed with helpful information. Next slide. Now it's my pleasure to introduce one of my favorite people to learn from. So Gregory Bocchino is an experienced higher education professional with expertise in career counseling, academic advising, personal development, and student affairs. He specializes in helping individuals identify their strengths, clarify professional values, and understand how motivation drives decision-making and behavior. Dr. Bocchino currently oversees career services for undergraduates and graduate students at the University of North Carolina's Gilling School of Public Health, Global Public Health, and is developing Designing Your Life and Career, a life design course for public health graduate students. He is a Gallup certified Clifton Strengths coach and teaches 3 academic seminars, Exploring Public Health Fields, Careers in Public Health, and the Public Health Discussion Series. He holds a Doctor of Education in Counseling and Human Development from the University of Rochester. And I am also very thankful because in addition to all of those things in that list, Greg has been willing to serve as chair of the Career Services Assembly. So he's currently the chair-elect for that group and is just always willing to share his expertise with the whole national stage, which is one of my my favorite things about this group is that it's very collaborative. And so we care about you as students and alumni, and we want to see you use your training, use your experience to have an impact in public health. Like that's what we want to see you do. And we will all collectively do whatever we can to help you be successful. So I'm gonna turn it over to Greg. And I think remind you that there's the Q&A box, okay?
Thanks, Brenda. Thanks for that warm welcome. Hi, everyone. Glad to be with you on hopefully this great Friday. Let me just get my screen shared all set up. Let's see. All right. just make sure everything looks good. Okay, great. Again, thanks for that warm welcome. I'm happy to be here with everyone today. Also, welcome to all the students and alums joining from all around the country. I'm ready to get started. Okay, many students and alumni are feeling stuck right now, especially with a cooler job market, hiring slowdowns, and more frequent layoffs in some sectors. It's completely understandable to feel unsure about who's hiring public health professionals, where to look, or even what job titles to search for. Today, I'm going to break things down with a clear, practical information and strategies so you can move forward with more clarity, confidence, and a stronger sense of direction in your career and job search. Many people don't immediately think of their public health degree in terms of the tools and transferable or translatable skills it provides, but that's exactly what makes it so valuable. Your training equips you with a broad marketable skill set that includes data analysis, policy insight, communication, collaboration, and leadership. These competencies extend well beyond traditional government or academic roles and are increasingly sought after across diverse sectors. Recognizing and articulating these skills helps you connect your public health expertise to the language and needs of employers in any industry. Skills-based hiring gives you more ways to stand out in a competitive job market. Through your core courses, electives, and applied experiences such as the practicum or your capstone, you've built a rich foundation of competencies that go far beyond subject knowledge. You've learned to analyze complex problems, engage diverse communities, interpret and apply data, and drive systems level change. Public health is everywhere, and your degree equips you to make an impact wherever health, people, and strategy intersect. By framing your academic work through the lens of skills and competencies, you can clearly communicate your value to employers across a wide range of fields. Now, building on that idea, Zoila Reyna, founder of Public Health Hired, urges job seekers not to get lost in the breadth of the field. Public health offers opportunities that extend well beyond traditional roles. Today, we'll explore some of these diverse sectors and companies hiring public health talent and begin connecting how your unique public health and discipline-specific skills may align with a new career path and job titles you might not have considered previously. Now, continuing on this theme, Wayne Voda of Career Pivot points out that while humanitarian or public health job titles don't always translate directly into corporate America, the underlying skills absolutely do. Corporations urgently need professionals with experience in crisis management, cross-cultural communication, and resource optimization. Your ability to coordinate stakeholders, manage scarce resources, and make data-driven decisions in high-pressure environments is exactly what recruiters are looking for. What's often missing isn't your capability, it's the translation. By reframing your public health title into its corporate equivalent, as shown in this table, you can open doors to roles in business continuity, operations, partnership management, and analysis that fully recognize the value you already bring. Now, as you begin translating your skills, it's also important to broaden your search terms. Employers today use a wide range of terminology that extends well beyond the phrase public health. You might find relevant roles under titles like population health, community impact, social responsibility, health equity, or even implementation science. I provided a sample list of keywords here to help you expand your searches and uncover positions you might not have thought to look for. Terms such as sustainability, biodiversity, and people and culture are increasingly tied to public health-focused work. Being flexible and exploring these types of keywords across sectors can reveal new and meaningful career opportunities. Okay, next we'll take a closer look at 10 specific sectors where public health professionals are making an impact. Each slide will highlight examples of organizations hiring in that space, real job titles, sample salaries, and in some cases, additional websites and resources you can explore further. As you review these, remember it's just as important to research each organization's mission and values as it is to browse their open positions. This helps you determine where your commitment to public health, community well-being, and meaningful work best align. We'll start with global health organizations. Now, global public health jobs have faced real setbacks due to major cuts in federal grants and international funding, but that doesn't mean the opportunities are completely gone. You can still find some meaningful roles within international NGOs, foundations, and global health organizations like the ones you see here. And don't overlook domestic employers. Some are engaged in global health work through partnerships, research, and community-based initiatives that reach far beyond the United States. While hiring may be paused in the short term, organizations like the Clinton Health Access Initiative remain key players in global health, and future opportunities are likely as funding landscapes shift and new initiatives emerge. Public health professionals are in demand in the consulting world, bringing their expertise to solve complex health challenges for a variety of clients. They analyze data, develop health programs, and advise organizations on policy to improve community well-being. Whether working with healthcare facilities, government agencies, or nonprofits, consultants leverage their skills in areas like biostatistics and project management to drive positive health outcomes. Roles like healthcare consultant, life sciences strategy consultant, and women's health consultant are found at firms such as Oracle, Huron, and the Analysis Group, offering public health graduates additional opportunities for dynamic and impactful career paths. Public health professionals also bring a valuable perspective to the biotech and medtech industries, blending their scientific knowledge with a focus on population health and well-being. You'll find roles in clinical research, managing projects, contributing to vaccine development, and using data science to analyze health trends. Look for job titles like clinical research associate, health scientist, or quality assurance manager at companies like Pfizer, Genentech, and Regeneron. It's a chance to apply your expertise to develop life-changing therapies and technologies. Okay, next is the pharmaceutical industry. Public health professionals here are hired to conduct research, analyze real-world health data, evaluate drug safety and effectiveness, and shape health policy, access strategies, and health communications. They work on clinical trial design, health economics, patient outcomes, and regulatory affairs, ensuring that treatments are not only effective, but also equitable and accessible. Their work helps bridge science, policy, and population health, making a direct impact on both global and local healthcare delivery. Job openings are typically available at top companies like Eli Lilly, Novartis, Merck, and Johnson & Johnson. Now, some state and local governments have several public health jobs available. Work includes environmental health, emergency response, health education, policy development, and community programs. These roles let you make a direct impact on communities while shaping public programs and responding to real-world health challenges. The USA.gov website serves as a central hub linking to every state's Department of Health website, although it may take a few extra clicks to locate each department's career page. Now, in contrast, publichealthjobs.org functions as a nationwide job board dedicated to public health careers. Now, as of this week, that website lists just over 1,500 open positions, with Florida, Texas, Georgia, California, Michigan, and Washington showing the highest numbers of job openings. Please note that it's important to check both websites, as not every state public health job may be listed on the publichealthjobs.org website. Now, the nonprofit sector offers powerful opportunities for public health grads to drive change on issues like health equity, food security, maternal and child health, and disease prevention. Organizations range from local community groups to foundations like the de Beaumont Foundation, advocacy groups, and national nonprofit organizations with a focus on health, such as the American Heart Association and the CDC Foundation. Roles cover community health, research, advocacy, education, program design, evaluation, policy, and fundraising. If you're passionate about mission-driven work and making a tangible impact, the nonprofit world is a natural fit, and it's full of diverse, meaningful career paths. For public health grads with strong research and data skills, there's a demand at a variety of organizations, including SAS, Mathematica, IQVIA, and Booz Allen. These companies work at the intersection of health, data, and policy, designing studies, analyzing health outcomes, and informing decisions that impact populations. Their work includes modeling disease trends, assessing treatment effectiveness, and developing predictive analytics. They often collaborate with healthcare providers, government agencies, and industry partners to translate complex data into actionable insights that improve population health and healthcare delivery. Job titles may include health data analyst, public health researcher, and or program evaluation specialist, for example. These roles span a variety of specialties from statistical modeling and study design to policy evaluation and real-world evidence analysis. Public health professionals at insurance and health plan companies are vital for improving health outcomes, managing costs, and fostering equitable care. They work in areas like population health management, quality improvement, data analytics, and developing wellness and prevention programs, ensuring policy and regulatory compliance along the way. Job titles may include Medicaid program consultant, quality improvement specialist, and community health program lead. These roles support both strategic planning and operational excellence, helping insurance companies and health plans deliver value-based, member-centered care. Employers like Blue Cross Blue Shield, Cigna, and Humana hire public health grads to help design smarter, more equitable healthcare systems. Public health professionals also play vital roles in hospitals and healthcare systems, working to improve patient care and promoting community health. They focus on areas like health disparities and equity, quality improvement, patient safety, infection control, and population health management. Their work spans community health outreach, science and research, analytics, and healthcare insights to drive data-informed decisions. They also lead sustainable service initiatives and community impact programs that address social determinants of health. Roles such as researchers, quality improvement specialists, and health equity coordinators help ensure hospitals deliver safe, effective, and equitable care to all patients. Plus, it's your opportunity to have a career with a broader impact on community health within a healthcare setting. Finally, the corporate sector is full of opportunity. It just takes a strategic, open-minded search to uncover the right fit. Top companies like Amazon and Coca-Cola are seeking public health talent for roles focusing on employee and customer well-being, social responsibility, and human rights and global health. Nike, too, is using data science expertise to analyze health trends, reflecting a blend of public health and business strategy. Public health graduates bring skills like data analysis to evaluate the effectiveness of wellness programs, communications to advocate for health policies, and program management to implement impactful health initiatives. Ask yourself, how could your skills in public health, communication, program management, or policy help companies improve health outcomes or advance social impact? Keep in mind that you'll need to dig deeper by going straight to their company websites, check their career pages, and think beyond the usual job titles to discover potential job opportunities. But wait, there's more. Based on a 6-month review of active job posting, I'm including 6 extra fields that further illustrate how your public health training, work experience, and transferable skills can align with additional roles and employers. These next 6 examples highlight even more ways your expertise can contribute to emerging in interdisciplinary areas where public health innovation and impact intersect. We might not initially think about K through 12 settings or non-research positions at colleges and universities, but public health graduates are well suited for careers in K through 12 education and student affairs, bringing expertise in program planning and evaluation, data collection and analysis, and an equity lens that addresses systemic barriers to student success. Training in community engagement translates directly to working with students, families, and campus partners to design wellness programs, prevention initiatives, and student support services, strengthening educational environments and promoting well-being at both individual and school-wide levels. Public health professionals also bring a unique mix of skills to communications and advocacy roles. You're trained to translate complex data into clear, compelling messages, design campaigns that change behavior, and apply an equity lens to ensure diverse voices are represented. Your background in program evaluation and policy analysis also strengthens advocacy efforts by grounding them in evidence. These transferable skills make you well suited to shape narratives, mobilize communities, and influence decision makers. Now, public health graduates bring strong skills in data analysis, program evaluation, system thinking, and equity, all of which are highly valuable in tech careers like digital health, user experience research, data analytics, and health informatics. These roles sit right at the intersection of health and technology, where translating complex data into user-centered, equitable solutions is in high demand. The good news is that there are many free and low-cost ways to build your tech toolkit, whether it's exploring AI applications in health or strengthening your data visualization skills through platforms like Coursera, Google, or the World Health Organization Academy. With your public health foundation, you're already equipped to shape inclusive, ethical, and impactful tech solutions. Upskilling simply helps you speak the same language as the evolving workforce. Public health careers in sports go far beyond the sidelines. They include roles such as nutrition directors, injury epidemiologists, community impact managers, and sports data scientists. Professionals with public health training contribute not only to athlete safety and performance optimization, but also to community wellness policy development, program design, and innovation that keep both players and fans healthy. Whether managing performance nutrition or professional teams, leading your youth health programs, or analyzing injury data for organizations like the NFL, these careers demonstrate how public health and athletics intersect in meaningful ways. By translating data-driven insights into actionable strategies, public health professionals drive research, improve player safety, and support decision-making at the highest level. While employers in the energy sector may present unique challenges, they also provide opportunities for public health professionals to advance health, safety, and environmental stewardship from within. Careers range from a corporate health, safety, and environment director who oversees worker health, environmental compliance, and safety in energy companies, to a sustainability and health impact manager who connects renewable energy initiatives with health outcomes and ESG reporting, to a health impact assessor who evaluates wind, solar, and bioenergy projects for health co-benefits and risks. These roles exist across industries, from oil and gas companies to renewable energy firms, utility companies, consulting firms, and tech innovators, demonstrating how public health professionals help shape a safer, healthier, and more sustainable energy future. Okay, the final bonus sector here or field has to do with fundraising. Careers in philanthropy and advancement in public health focus on securing the resources that make programs possible. Graduates bring skills in data analysis, program evaluation, stakeholder engagement, and strategic planning, which help demonstrate impact and build relationships with donors. Strong communication and equity-focused program design further equip you to cultivate support, secure funding, and advance community health initiatives. Okay, I know that was a lot of information, but before we get to the Q&A section of the presentation, I want to highlight a few websites, Substack, and LinkedIn resources to help your job search and career planning efforts. As you search for jobs, don't just rely on big platforms like Indeed or Google or LinkedIn. Explore public health specific sites like the APHA Career Mart, ASPPH's public health jobs page, and state health department websites. These targeted strategies can help reveal new job openings and expand your view of potential employers across a wider range of fields. Plus, check out the on-demand professional development webinars on the Delta Omega homepage for additional career resources. Public Health Hiring Help is a free weekly newsletter designed specifically for students, recent graduates, and early career professionals looking to enter the public health workforce. It curates job listings across sectors from internships to full-time roles, making it easier to navigate the sometimes opaque world of public health employment. The Public Health Spot is a global career development community on LinkedIn designed specifically for public health professionals and students. They offer a rich collection of resources, including webinars, podcasts, job search strategies, profile building guidance, and peer networking to help you move from classroom to career with confidence. The Public Health Club is a dedicated community focused on career development, consulting, and networking for public health professionals. Their LinkedIn page regularly shares real-world advice and resources on topics like public health entrepreneurship, tech sector transitions, and finding non-traditional jobs. Now, two valuable tools available to support international and globally minded students are Interstride and Going Global. Interstride helps students navigate their career journey in the United States and abroad by offering job and internship listings filtered by visa type, guidance on CPT, OPT, and H-1B processes, and access to webinars and networking resources. Going Global, now part of Interstride, complements this with detailed country and city guides highlighting local job markets, visa regulations, and cultural insights. Together, they empower students to explore career opportunities confidently anywhere in the world. Make sure you check to see if your university career service offers partners with either platform for access to Going Global or Interstride. Finally, please don't forget to visit your career services office, whether at the university level or within your specific program, department, or school of public health. Schedule an appointment soon to discuss applying to jobs, your career plans, and job search strategies. And graduates should also check for resources that support alumni career planning and job search needs. Okay, that brings me to the end of my slides, and we have the rest of the time to open it up for Q&A.
Thank you so much. And oftentimes in these webinars, we end up with, 10 minutes and 100 questions. So we very intentionally wanted to make sure that there was time for questions and discussions. So make sure that you look to that Q&A box and put in any questions that you have. Greg, there is already one question that says, as a new MPH graduate, do you recommend partaking in a fellowship or an internship prior to applying to a job?
Yeah, I would. The way I look at it is when you look at the job opportunities and the job descriptions that you're interested in applying for, what are the list of requirements and skills they're looking for? And what can you pursue during your academic degree to acquire these kinds of experiences? So we call that career prototyping, where you have the ability to get glimpses of careers, acquire skills, and it could be a fellowship, it could be an internship, it could be job shadowing, it could be also, working on side projects to gain extra skills. So I don't know if there's one right answer to that question, but I'm always a proponent of gaining experiences to help equip you with more tools and make you marketable for the workforce. Brenda, do you have any perspective on that?
Yeah, one thing I'll add is that because there's some differences between sectors when it comes to the phrasing internships and fellowships. And so sometimes that can be confusing for students. And so in public health in general, internships tend to be part-time experiences for folks who are currently students. And then fellowships tend to be that transitional experience. So after you've graduated, and they are actually a full-time job. And so there are a lot of public health fellowships, like people, like students won't realize that you actually get a full salary and you work full-time, even though it's called a fellowship. Sometimes it might have a stipend instead of actual like benefits for something like health insurance. So you'll want to look at the fine print for all of those details. But that's something to keep in mind, that internships tend to be for current students, fellowships tend to be for that transition of your first job out of graduation. With that said, fellowships tend to be open to anyone within about 3 years of graduation. So even if you graduated a year or two ago, still look at fellowships to see if you're still eligible. And similarly, I have been seeing some paid internships that are open to recent grads. And so just kind of always pay attention to those eligibility criteria. The other thing, before we get to this next question, the other thing that I want to acknowledge is that today's content was a lot. And the goal was to get you thinking, like to get all the little I'm not a neurologist, so I don't know what they are, but I'll get all the things firing in your brains of like, oh yeah, like we understand the social determinants of health. We understand how all of these things are connected, and we can use our frameworks and our like systematic approaches and our skills in different settings because we know how to break stuff down and understand really complicated stuff and then find concrete ways to have an impact. Like that's one of the things, like if we strip away all of the sector specific language of public health, that's what we're trained to do. And so this webinar hopefully gave you some ideas of like, what are some out of the box places? And I can tell you that all of us have had alumni go into most of these sectors. Like we know people who are doing it. So these are not outlandish ideas by any means. And then to decide where to explore for you, you will have to start with reflection. So it's not that each one of you will look at all of these options. You need to reflect on what exactly are you really good at, and then find the spot of what Greg mentioned that would make sense. Okay, we've got some more questions in the queue. So for someone completing an MPH who has worked part-time all throughout the program and has 1 year of full-time work prior to the MPH, I love this question. How many years is that? Because those job descriptions do say you need 2 or 3 years of experience required, and they're going to do the math, Greg. Tell us how they do the math.
Yeah, I've recently seen more job descriptions now saying that your degrees also equate to a year of experience. So, I would, calculate sort of your experiences, including volunteering, practicums, any positions that contributed to your skill set achievement, and don't necessarily undersell yourself when it comes to applying to these jobs, because you never know what else you may have that other applicants might not have. So I would always encourage students and others to apply. Brenda, what's your advice on this one?
Just to pay attention if they have that language about the
Right.
degrees, because that has been added, but just make sure you do the math. And so if it says 3 years of experience required, just be aware that your part-time student work. So if you've done that for a year and you work 20 hours a week, that's going to be 0.5 of that year of like FTE. So do the math, because if you are submitting an application with all the boxes, a computer is going to do the math. And so this is when I will tell people to make sure that you're being thoughtful of your unpaid stuff and getting it up into your work experience section so that the time is counting towards that years of experience. Because you don't want something very relevant, like your applied practice experience, for example, if you put that down in your volunteer section, the experience might not get counted in that years of experience requirement. So put anything that's relevant up in that work experience so that the math will work in your favor. Okay, so we have a question about, are there specific fields or positions that would be better to work in with a PhD?
I'd have to say, after reviewing position descriptions for the last 6 months, some of the fields that consistently are looking for applicants with doctoral PhD research training typically end up in the pharmaceutical industry, in the data and analytics industry. Also think of hospital and healthcare settings, because they're looking for people with the doctoral level training and methodologies and research experiences and expertise that focus on their agendas in those organizations. Those three tend to come to mind too, but that doesn't preclude for other sectors, um, like local and state government opportunities too.
We have a couple of questions related to academic experience and helping make that feel relevant to non-academic settings. So I'm going to read the questions and you can decide if you want to address them together. So how do you advise we write and speak about our experience in academic settings so that it can address the stereotype that people in academics don't work very hard? And then also more on the mindset, any good advice on how to mentally switch from an academic student mindset worldview to a real world public health researcher or worker. This person's never had an actual job outside of school, and so is not sure how to mentally prepare for making that switch from academics.
Yeah, the latter part, I would suggest if you can network and engage with alumni from your program or your school to start having conversations about this, that could also think critically about how to move from point A to point B. It will also give you that perspective of, right, working in these different environments and these different organizations and how to make that translation work for you. The other thing about academics is, right, how do you deconstruct your degrees and experiences and then reconstruct them based on the skills, competencies, and language that we know people in other fields are going to be looking for? Now, you can certainly get assistance with a career counselor or career coach at your college or university to do this, but you can also get creative with ChatGPT and other AI platforms to help you do that. Now, I never suggest having ChatGPT create an entire resume or cover letter for you. What I usually suggest is that you use it as a tool to help you translate and illustrate your information in different environments. So you might cut and paste the content of your resume, put that into ChatGPT and say, hey, ChatGPT, what does my experience look like in the pharmaceutical industry? And give me the 5 main categories that overlap between the two. You could probably also find a job description in the pharmaceutical industry, cut and paste that link into ChatGPT so it could also overlap it based on positions that you're really interested in pursuing. Brenda, your additional insight?
Yeah, I just to elaborate on the how to use AI piece of it. That's one of my favorite ways. And there's actually a couple questions in the queue from folks who have been at federal agencies and are looking for how to transition out of government. And so they're wanting some specific advice on how to switch to the private sector. And And some of what Greg just said is one of my favorite ways to start training your brain to use different language. And so when you put a job description into AI, I like to ask it to summarize the job description and tell me what are the top 3 things that I would want to really emphasize and highlight in an application or an interview. And this helps get it into more plain language because sometimes job descriptions are really confusing. And then in the scenario that the person in the Q&A put in there, I would add that in. I would say, all of my work experience so far is in X. How would I translate things that I've done in XYZ for this role? And so it's some of it's what Greg was just saying, but just use very specific language. And the output is surprisingly helpful. It will give you suggestions of what similar things you could translate. The other thing, because this answer originated with a question about academic experience, and I will tell you that if all of your experience is from an academic environment and you are applying to a job or an organization that does not talk about their work with the word research, you need to remove the word research from your vocabulary and replace it with something that matches what they are talking about. And what I mean is that if you had a final project where it was called like a research project for your academic program, and you designed a survey or you did data analysis, and then you prepped a summary of that and did a presentation. And for your academic program, that whole cycle is called research. But you're applying to a job that is talking about all of those skills as part of quality improvement or part of data, like being a data scientist or whatever the word is. Talk about that as a project, not research. And I can tell you I've done interview prep with alumni who were not getting anything. And in one mock interview, I hear them talking about all their research. I'm like, oh, I know what's happening, because there is a bias in practice that if all of your experience is research, you might not understand the practice lens. So just that switch can make a big difference.
Yeah, the one thing that I just want to share too, Brenda, based on what you're saying too, is that, this all takes a lot of work. And so, whether you're a student or you're an alumni or you're in the workforce looking to pivot, the job search practices is involved. Brenda and I can give you some insight and advice, but it takes an inordinate amount of time with intentional focus to help you, land or find the right job opportunities to then apply for. And then the goal is, right, with your documents to get the interview. So it does take work on your behalf to do research, to go on these websites, to start looking at company profiles, to, read industry trends, to read business reports, to look at the business news, to pay attention to what companies are doing better in the stock market. I mean, there's a lot of things that I look at during the week to help give me some perspective and inform me on what's happening in the job market. It's not just one thing, it's many factors that contribute to the overall job market. And as you know, Brenda, many of us are in the job market for 30 to 40 years, and it ebbs and flows on the blink of an eye.
If you are someone in the Q&A who put in a question around something very specific of my experience is in X and I'm looking to switch to Y, what suggestions do you have for me? Greg just answered that. So it is a process where I think you could start with some of the language he introduced today to see what resonated. Were there things in there that when he was talking, you're like, oh yeah, that's very similar to what I've done? Then start by going and looking up those things. and then seeing, is it just a matter of translating and using different language for what you've already done? Are there any skills gaps that you actually need to fill? I can tell you that your path to employment is not simply getting more credentials. It's often more about understanding yourself and the value that you can bring to any sort of environment. And a specific tool you can use if you need a little bit of help, get like putting everything that Greg has described, go to Google Career Dreamer and you can enter your positions that you have had, and it will take you through a set of tasks and skills statements that are going to strip away some of the industry jargon and start training your brain to think about what you've done in the way you'll see it showing up on job descriptions. You can do that for a couple of positions you've had, and then it's going to give you a word cloud of real jobs. And when you click on those, it will show you where you have overlap already with those positions and where you might have gaps. So that could be a way where you could blend all of the menu of options that Greg presented today with your specific circumstances, if we didn't get to some of your specific questions. You mentioned the work. Oh, sorry, were you going to say something, Greg?
Yeah, I was just going to add, I read an article on LinkedIn yesterday that really implored people to demonstrate their impact, because employers and applicant tracking systems can calculate your years of work experience in different sectors. But how are you demonstrating your impact for the future position and the future organization or employer? Are you connecting those dots for them to easily see how you can hit the ground running based on what you've done previously?
On the note of how much work this takes, there's a couple of questions about the volume of applications people are having to submit. And some of the questions are, I've heard of people applying to 50, 75 positions and not even hearing back. Also heard of companies putting up fake job descriptions. Is that an urban legend? Can you speak to any of that dynamic? You've already given some of the advice of how to overcome that in terms of the tailoring, but any advice also?
Yeah, if you participate in LinkedIn and start joining some of those LinkedIn groups or newsletters that I suggested in the presentation, you'll begin to start reading the narratives and experiences around ghosting. It is real, and I've been trying to discover some strategies for applicants to sort of get a leg up in these situations, and there's no one solution. There's not many solutions. And the applicant tracking systems are not new. They've been in effect for many, many years. The, you do see some data or just articles on when a position is posted, apply to it as soon as you see it rather than waiting until the close date, because some employers now are closing positions once they reach a certain number of applications. Now, I have seen in a very small number of job postings where it says, once we reach this number, number of applicants, we're closing it. But that was maybe one out of hundreds. And so if you see a position description, a job ad, and you look for it the next day and it's not there, chances are there's so many people that are applying to it. I would suggest, right, start figuring out the way I think about it is, who are the employers that you want to work for? Are you regularly checking their HR jobs websites? And by regularly meaning, are you going to their websites on a daily basis to get a sense of what positions are being posted, what new positions are being added, and scanning them to see how quickly other jobs are being filled? That's one way that you can sort of analyze this from your own experiment to get a sense of, okay, now I get a sense of how this works for this organization, because there's no one size fits all across the employment spectrum. Brenda?
Love it. Yeah. And same thing, if you are able to narrow in um, maybe like your top dozen or so wish list organizations, state health department HR people are really good at pushing things out on LinkedIn. So follow specific, like the HR or the recruiter people from specific organizations. That can be one way to cut through the noise of fake postings versus real postings. So that's one helpful thing. There is a question kind of similar if you're trying to like get your foot in the door. Should you try to network with someone, or can you apply without knowing someone at the organization is sufficient? Like, what's the best practice there?
Yeah, this year I've been suggesting doing a networking gap analysis. So identify the industries or the employers that you're interested in pursuing, then sort of connect the dots with who you might know currently that either works in those organizations or knows people that work in those organizations, and then see where the empty slots lie. And that's really, I think, the work to strategize, to make connections, to have conversations, to then be more intentional about informational interviews, having sort of coffee chats, going to some of their events. You know, some organizations have community events. You know, I just spoke with an alumni. We're talking about the community events that they go to, whether it's a fall festival on their main street, whether, you know, they're volunteering for Habitat Humanities. They're interacting with all kinds of people with the goal of making intentional connections. And so there is some, you know, say in being an internal reference. And this is where you can capitalize on connecting with more people. You know, if your college or university or program or department have alumni networking gatherings, whether they're virtual or in person, there's another way that they're trying to connect you with other people who might have valuable career information for you. That takes also a lot of work, especially if you're, you know, naturally introverted. I mean, I'm not always the first one to go up and talk to people that I don't know at networking events, but I have strategies to engage me. Like I would take Brenda because Brenda is more extroverted than I. And that would be my strategy because I know Brenda will initiate the conversation. And I can also strategically ask my questions when Brenda is there starting the process. So there's tips and tricks and tools that you can learn to, you know, help you. But I do think if, you know, if you got to start somewhere, and, you know, the upcoming holidays is a great way to connect with family and friends who may not even know you're searching for jobs or looking to pivot or that you've been out of work. Here's the time to have conversations because what is it, 6 degrees of Kevin Bacon? You never know who you're sitting next to at an event or at a dinner. In fact, at one conference, I was sitting next to one of the world's best known student development theorists. And I didn't know it until he started talking to me. And not that he divulged it, it just revealed itself after our conversation. So, yeah, I definitely would suggest making more connections. Brenda?
Well, and this, what you just ended on, is a perfect way also for you to practice talking about yourself in different ways. Because for too long, we've all just kind of accepted, I'm in public health, no one knows what that means. I'm in public health, no one knows what I do. Well, that was funny for a while, it does not work on the job market. If you don't know how to explain what you can do, how can an employer hire you? And so those situations that Greg was just talking about are a perfect way for you to try. For before the interview, that's very stressful. Try talking to your friends and family about something you've been doing recently in a way they can understand. That is a first perfect step for interview prep. Greg, we're gonna likely round it off because we have 5 minutes left. We have a whole series of questions related to the tactics of applying. I'm going to tell you what the areas are. So there's a theme on cover letters. So if someone's wanting to know about the value of cover letters, especially since there's so many of those things that let you just like easy apply without one. And someone who's actually part of a hiring committee also said, the importance of the cover letter. I recently was part of a search committee where we had over 600 applicants in 10 days. Over half the applicants did not clearly meet the job requirements. So that was just kind of a plug, but also a plug for cover letters. So we're going to talk about that. Then specific suggestions for resumes to stand out. And especially if you may not, or if you're unsure about whether you meet all of the experience requirements or preferences. And then the third part of this is AI interviewing. And do we have thoughts on that? So I'll let you decide how to tackle these things.
Yeah, I'll share quickly and see if we can cover them all. So definitely do a cover letter. I always suggest it's your opportunity to share more information. You can, highlight, make some personal connections. The way I would use AI is in a job description, share with me the top 3 areas of focus for this position and have AI sort of give me those top 3. And I would cover those 3 things in a cover letter, making personal connections. So I always share, like, the start of my cover letter is like, I'm from a family of educators. I care about students. I care about the work that I do. And this is why I'm pursuing this position. So you're demonstrating not only all of the other stuff that connect with the position, but why it's personally meaningful to you. Now, right, if it doesn't say cover letter, you don't always have to include one. And people might think, oh, right, if you include one, you're not paying attention to instructions or details. And then there's all sorts of, anecdotes, like sometimes people don't even read the cover letter. I would say put a cover letter together and have one to tailor to each position. Doesn't have to be a very long cover letter if it doesn't say include a cover letter. The strategy about a resume, I would suggest developing a professional profile at the top of your resume that you tailor bulleted statements that are relevant to the key responsibilities and qualifications of the position, because there's actual research on employers and HR people, their eye movements on resumes, and it's either a T or an F. So they follow the top heading across the page, down the left margin, and across the middle. So when you create a professional profile, you know that they're going to scan all of, and then you've intentionally put all of the right things up there that employers are going to look at. All right. What were the other 2, Brenda?
What do you do if you're unsure if you meet the qualifications? And then any thoughts on AI interviewing? 2 kind of big ones in 60 seconds.
Yeah, if you're unsure if you meet the qualifications, I would, if it were personally me, or if I was working with a student or an alumni, I would suggest still applying, because you just never know who else is and isn't applying. And when you look at some of the data, now there is research on this too, Brenda, on who applies, not having all of the qualifications. There are percentages of people that just go for it, and then there's a high percentage of others that don't, but they still all don't meet the full qualifications. So I would suggest applying. And the last piece of AI and like a AI bot interviewing you and sort of collecting information. Yeah, I don't have a whole lot of perspective on that. I do think with the number of applications increasing that you'll see more of that in some capacity. So I'm not going to weigh in either side of it because I know it's happening. And if it's part of the requirements for the application, you'd still have to proceed with it. Right, Brenda?
Yeah, I think it's something we just have to watch.
Yeah, I agree.
So we're at the top of the hour. So I also want to give a shout out. If you've been following along in the Q&A, we also have like the typing champ, Deanna from Texas A&M, who has been answering some of your questions directly as well. I think we got to so many of your questions. I know you still have more. Please seek out your career services folks from both your school or program of public health, but also undergraduate programs. Oftentimes they will allow alumni to come back. And even if they have had parameters of like, oh, you have to be within 2 years of graduation, right now a lot of schools have loosened that up. So it doesn't hurt to like circle back and check to see if you can get a resume review. And if they aren't, then I would suggest asking your alumni relations if that's something they could help facilitate for alumni. I want to just thank Tracy and ASPPH for making this possible, Greg for prepping such amazing information, and thank you all for joining us, and I hope you have a great weekend.
Thanks, everyone.